It's early morning. You walk to the kitchen to make your coffee, just like you've done 1,000 times before. But as you reach up to grab your favorite mug from the shelf, your knee buckles, just slightly, just for a second. You catch yourself on the counter. Your heart is pounding. Nothing happened. You're fine. But that moment stays with you all day. Because deep down, you know it wasn't the first time. Maybe you've noticed that getting up from your favorite armchair takes a little more effort than it used to. Maybe you hold on to the wall when you walk down the hallway at night. Maybe you've started avoiding stairs when you don't have to. And maybe, just maybe, you've started to wonder if this is just how things are going to be from now on. I want you to hear this clearly. It doesn't have to be. What you're feeling in your legs, that shakiness, that uncertainty, that quiet loss of confidence when you stand up, that is not simply getting old. That is something specific. And more importantly, it is something you can actually do something about. In the next few minutes, I'm going to explain exactly why this happens after age 75. The one mistake that almost every senior makes that quietly makes it worse over time. And then I'm going to walk you through 3 simple, safe movements you can do today, right at home, with just a chair or a wall for support, that physical therapists recommend specifically for this problem. By the end of this video, you'll understand what's really going on in your body, and you'll have a real plan to start feeling steadier, stronger, and more confident on your feet. Stay with me. Why this happens, the real explanation. So let's talk honestly about what's going on. After the age of 60, the human body begins to lose muscle mass at a rate that most people don't realize is happening. It's gradual, it's quiet. You don't feel it the way you feel a pulled muscle or a sore knee. It just slowly happens in the background of your life. The medical community calls this process sarcopenia, but all you really need to know is that it means your muscles, especially the ones in your legs and hips, start to get smaller and weaker over time if they're not regularly challenged. The National Institute on Aging has spoken about this extensively. The muscles most affected are the ones you rely on for everything: standing up, walking, catching yourself before a fall, climbing a single step. Your quadriceps, which are the muscles in the front of your thighs, your glutes, which support your hips and pelvis, and your calf muscles, which act like little shock absorbers every single time your foot hits the ground. When those muscles weaken, your joints, especially your knees and ankles, start to take on work they were never meant to handle alone. That's often where knee pain comes from, not because your knee is broken, but because the muscles around it are no longer doing their job of supporting it. And here's the part that surprises most people. Your balance is directly connected to your leg strength. Research suggests that fall risk increases significantly when leg strength drops below a certain threshold. The two things are not separate problems, they are the same problem. The Centers for Disease Control and Prevention has consistently identified fall prevention as one of the most important areas of focus for adults over 65. Falls are one of the leading causes of serious injury in older adults, and a large portion of those falls are connected to leg weakness and poor balance, not bad luck. So when your knee buckles reaching for that coffee mug, that is your body giving you a signal. Not a signal that your life is getting smaller, a signal that your legs need some attention. Now here's the part I really need you to hear, because this is something almost every senior does and quietly makes the problem much worse over time. When legs start to feel weak or unsteady, the most natural response in the world is to move less. It makes sense, right? If walking feels shaky, you sit more. If getting up feels hard, you avoid doing it unless you have to. If the stairs feel risky, you stop using them. You start to protect yourself by doing less. And in the short term, it feels safer. But here's what actually happens inside your body when you do that. The muscles that are already weakening begin to weaken even faster. Because muscle, unlike most other tissue in your body, responds directly to use. When you use it, it maintains itself. When you stop using it, it shrinks. Physical therapists have a phrase for this that's worth remembering. Sitting is the enemy of strength. Not because sitting is evil, but because extended inactivity, especially after a scare or after a period of illness or recovery, can take weeks of progress away in just a matter of days. And so the cycle begins. Legs get weak, so you move less. You move less, so legs get weaker. You feel less steady, so your confidence drops. Your confidence drops, so you move even less. And slowly, without anyone pointing to a single dramatic moment, independence starts to feel fragile. I may recognize this cycle in yourself or in someone you love. The good news, and I mean genuinely good news, is that breaking this cycle does not require a gym membership, a physical therapist appointment every week, or hours of exercise. Research suggests that even short, consistent movement sessions done regularly can meaningfully improve leg strength and balance in older adults. 10 minutes done daily can make a real difference over time. Let me show you how. Safety note. Before we go into the movements, one important sentence. If you have severe joint pain, recent surgery, a history of fractures, or any medical condition that affects your movement, please talk to your healthcare provider before starting any new exercise routine. These movements are gentle and low impact, but your doctor or physical therapist knows your body best. The 3 movements. All right, let's get into it. You'll need either a sturdy chair or a wall for light support. That's it. No equipment, no gym, no cost. Movement 1. Sit to stand. This one sounds almost too simple, but physical therapists consider it one of the most powerful functional exercises for older adults because it directly trains the exact muscles you use every single day. Here's how to do it safely. Sit near the front edge of a sturdy chair, not leaning back. Place your feet flat on the floor, about hip-width apart. Now, lean your chest slightly forward. Think of it like your nose going past your toes, and push through your heels to stand up slowly and in control. Once you're fully standing, pause for just a moment, then lower yourself back down slowly, slowly is the key word here, and sit gently. Don't drop back into the chair. Control the whole movement on the way down. That lowering part, that is actually where most of the muscle building happens. Physical therapists call it the eccentric phase, and it's the part most people rush through. Start with 5 repetitions. Take your time. If 5 feels too easy after a few days, try 8. The goal is not speed. The goal is control. Movement 2, standing heel raises. This one is for your calf muscles, those shock absorbers I mentioned earlier. Strong calves also play a major role in ankle stability, which is one of the hidden factors in fall prevention that doesn't get talked about enough. Stand behind your chair and hold the back of it lightly, just for balance support, not to hold yourself up. Feet flat, hip-width apart. Slowly rise up onto your tiptoes. Hold for just a breath at the top, then lower back down slowly and with control. That's 1 repetition. Try for 8 to 10. Here's a small test you can try right now if you feel comfortable. Stand next to a wall or counter and try raising up onto your tiptoes 10 times. How does that feel? Is there shakiness? Do you lose your balance before you finish? That's useful information. It tells you how much your calves are being asked to work without regular training. Do this movement daily, and most people notice a real difference in ankle steadiness within 2 to 3 weeks. Movement 3. Standing knee marches. This one looks simple, but it targets your hip flexors and your core, 2 areas that directly affect how stable you feel when you walk, especially on uneven surfaces like grass, parking lots, or slightly uneven sidewalks. Stand behind your chair again, holding lightly for support. Stand tall, think of a string gently pulling the crown of your head toward the ceiling. Slowly lift your right knee up toward your waist, not as high as you can, just a comfortable, controlled lift. Hold it there for 1 or 2 seconds, then lower it back down with control. Now do the left side. Alternate sides for a total of 10 lifts on each leg. The key here is not how high your knee goes, it's the control. It's the balance required to stand on one leg, even briefly. Because walking, real walking, is essentially a series of single-leg balance moments repeated over and over again. This movement trains exactly that. If you feel unsteady at first, that's okay. That's actually your nervous system learning.
It gets easier with consistency. Putting it together. So let's put this into a 10-minute routine you can actually follow. Start with a minute of slow walking in place, just to warm your body up gently. Then go through 10 sit-to-stands, 10 heel raises, and 10 marches on each side. Rest for 30 seconds if you need to between each one. Then repeat the whole sequence one more time. That's it. 10 minutes. Done at the same time each day, maybe after your morning coffee or right before lunch, so it becomes a habit rather than a decision. Research suggests that consistency over time matters far more than intensity. You don't need to push hard, you need to show up regularly. You know, one of the things I hear most often from older adults who've worked to rebuild their leg strength is this. They didn't realize how much fear had quietly crept into their daily life until it started to go away. The hesitation at the top of the stairs, the way they gripped the shopping cart a little too tight, the relief they felt when they finally sat back down after walking through a parking lot. They had stopped noticing it because it had become normal. But normal doesn't have to be permanent. The body, even at 75, even at 80, even beyond, responds to movement. Research consistently shows that strength and balance can improve at any age when the right kind of gentle, consistent activity is introduced. Your muscles have not forgotten what they're supposed to do. They just need to be reminded. Start today with just one set of those 3 movements. Just one. See how it feels. Notice if your legs feel a little more engaged, a little more awake. Come back tomorrow and do it again. Because independence isn't built in a single dramatic moment. It's built in 10 quiet minutes, repeated day after day, until you realize you're walking to the kitchen in the morning without holding the counter, until you're standing up from your chair without bracing yourself, until that moment of shakiness becomes a distant memory. You deserve to feel steady on your feet. You deserve to move through your own home without fear, and you are not too old, too weak, or too far gone to get there. You just have to start. If you found this helpful, subscribe for more safe and simple tips to help you stay strong and independent. And if you know someone who could use this today, a neighbor, a sibling, a friend who has mentioned being worried about falls, share this video with them. It might be exactly what they needed to hear. Take care of yourself. I'll see you in the next one.